name is Dr. Christy Winthizer. Thank you for joining me today. The goal of today's video is for you to watch me do a teaching demonstration. In this teaching demonstration, you'll find me use 3 teaching strategies. I'm going to use lecture, a think, pair, share activity with NCLEX type questions, as well as a small group activity. I should share that for the NCLEX questions, you'll see them copied verbatim in this lecture. Students have access to this book and we use it regularly in class, so this is not a copyright infringement. Let's get started. So we're going to talk about alterations in pulmonary function today. Our main objectives for learners are to describe the clinical manifestations of asthma. We will compare and contrast chronic bronchitis and emphysema, as well as identify 3 main types of pneumonia. We're going to start with obstructive lung disease. So this is a narrowing of the airways that results in airway obstruction that gets much worse with expiration. So as the patient tries to breathe out, they find obstruction. And so in your patients, you're going to see things like accessory breathing, pursed lip breathing, sitting up in the tripod position to try to get comfortable to breathe, increased work of breathing, so just working much harder, dyspnea or shortness of breath, and then wheezing. Let's start with asthma. So asthma is a chronic inflammatory obstructive lung disease process. There's 3 main parts to asthma. There's the bronchial hyperresponsiveness, there's the constriction of airways, and there's the reversible airflow obstruction. And reversible is critical here because when we talk about management in terms of medication, you're going to see how we can reverse that airflow obstruction. So this diagram here shows you the mucus plugs that we get, the mucus accumulation, and the hyperinflation of that alveoli. So clinical manifestations you may see in your patient are expiratory wheeze, and again, that's that patient breathing out hard to get through all this constriction in the airway. You're gonna have a prolonged expiratory phase because they're trying hard to push all that air out. They're gonna have cough, and they may have a drop in their blood pressure with inspiration, and that's called pulsus paradoxus. Treatment includes allergy control, so that may mean things such as allergy medications or environmental changes in the home. Short-acting beta agonists such as albuterol will help with that airflow or airway constriction, which will decrease the amount of expiratory phase that patients need. And then inhaled corticosteroids are really the mainstay of day-to-day management for asthma. Next, we're going to talk about COPD. COPD has really 2 groups to it. It has chronic bronchitis and it has emphysema. It's the most common lung disease in the world and causes persistent airflow limitation, which makes it hard to get air out. This is a progressive disease with no cure. Risk factors, major one is smoking, so tobacco exposure, as well as environmental things such as occupational dust and chemicals, air pollution, or any factor that may affect the anatomy of the lungs as this child is either growing in utero or shortly after birth. In med-surg, we're going to talk way more about nursing care, but one point I want to make right now is that with these patients, we're really careful of how much we supplement their oxygen. So they may come in with a baseline oxygenation of 88 to 90%. We probably won't want them to get much higher than that. And the reason is much higher oxygen can cause hypercapnia. And we talked about that last week, and that can really affect our patients, letting that CO2 level get too high. So these patients, we're gonna let their O2 level ride a little bit lower than the typical patient that comes in with pneumonia that maybe we would want to supplement. So chronic bronchitis then is hypersecretion of mucus, and they'll have this very chronic productive cough, and it really comes from this very thick mucus. So there's going to be increased mucus production, increased amount of mucus glands, and the mucus is very thick, and it's a lot of it. So patients have a hard time coughing it up because of the thick, kind of tenacious nature of the mucus. Cough tends to be worse in the morning because patients are laying flat, and that mucus is just sitting in their lungs accumulating. And so then in the morning, they sit up and start moving all that mucus and coughing it out. Treatment, again, bronchodilators, similar to asthma that we talked about, right? That albuterol is going to open up those constricted airways. Expectorants are going to help move that mucus out of the body. And then chest physical therapy. So chest physical therapy, you'll learn about in your skills and assessment class. But that's really where we're patting on the back of this patient's back, maybe using some mechanical devices such as a vest therapy, and really try to move that mucus along so that patients are able to cough it up. Let's talk about emphysema. So emphysema is an abnormal permanent enlargement of the gas exchange area without any obvious fibrosis. And so really there's a destruction of the alveolar wall, which affects the alveoli. Again, smoking is really the #1 cause. The chemicals can break down that alveolar wall. So the bronchial wall closest to the alveoli becomes weak and it collapses during expiration. And I'm going to show you that in a minute in terms of what that looks like for a picture. There's not a lot of recoil, and so then air trapping becomes a problem. When we get air trapping, patients can actually oxygenate fairly well. So oxygen is going to make it down to the alveoli. It's that CO2 that has a hard time leaving. And because, again, patients are going to be pushing out hard to try to get that air out, then they're going to get some air trapping and expiratory wheezing. So here's an image to demonstrate that. So this is an inspiration. You see that oxygen makes it in well to that alveoli, no problem. During expiration, we get some of that bronchial wall collapsing, and that is when that air trapping shows up, right? And so now we've got that air trapped in that big alveoli, it doesn't recoil, and we've got chronic CO2 retention because it can't leave during expiration. So let's do a knowledge check. Let's practice an NCLEX question. So the nurse is instructing a hospitalized patient with a diagnosis of emphysema about measures that will enhance the effectiveness of breathing during those dyspneic periods. Which position would the nurse instruct the client to assume? At this point, with a real group of students, I would ask students to ponder this for a second or two, then share with their partner next to them. I'd give them a minute or two, and then we'd come back together and talk about the correct answer. So assuming that students had an opportunity to think about this and there's been some dialogue in the classroom, I would then reach out and ask students, what do people think about this? 1, 2, 3, or 4?
4.
4, perfect. So 4 is absolutely correct. We're gonna have patients sitting up and leaning on that overbed table. And we talk about why that works. And so that works for a couple of reasons. One, patients are able to use those accessory muscles more because of the position that they're in. And so it helps lift that chest. And the other reason is it's just gravity helps, right? So if they're leaning forward, we get that diaphragm to drop, and then they have more room for lung expansion. So perfect. Number 4 is the correct answer here. All right, another objective that we have today is really to be able to compare and contrast chronic bronchitis and emphysema. And so this is a small group activity I have. So for students, you see a list of symptoms here on the right, and I want you to put them on the Venn diagram. So if it just goes with chronic bronchitis, it's on the left. If it just goes with emphysema, it's on the right. If it applies to both disease processes, then I would ask you to put it right here in the middle. Now, some of you are going to look at this list and say, well, gosh, this probably happens with every disease process, right? Of a severe respiratory disease process. I don't want you to think like end of life, right? Or like at the end of the disease. Think about this early diagnostic time and what you would see. So I will ask students for about 5 minutes to work together in a small group and work on this activity and come back together. At the end of their 5 minutes of working back together, I'll ask if anybody has any questions and ask a group or two to come up and share where they put these diagnoses on their Venn diagram. So this is my small group activity that I wanted to demonstrate to you today. After the small group activity, we'll come back together and resume lecture. We're going to move on and talk about a respiratory tract infection. We're going to talk about pneumonia. So pneumonia is a lower respiratory tract infection. It's caused by bacteria, it's caused by viruses, fungi, protozoa, or parasites. 3 kind of main types of pneumonia that I want you to think about are community-acquired pneumonia. And so this may be caused by bacteria such as streptococcus or a virus such as influenza. And then we see 2 pneumonias that you can get in the hospital setting. So you could have hospital acquired from just being in the hospital. We see this a lot with our post-operative patients. And that's why we worry when they get atelectasis, that we want to get them up and moving and doing deep breathing. So if we're doing good in central spirometer and we're doing good ambulation, hopefully we're not seeing a lot of this. And then we have ventilator-associated pneumonia, and so that's patients that are ventilated in the ICU can acquire pneumonia from that. Symptoms can include cough, fever, chills, and malaise, so just over on that, not feeling well. Let's do another knowledge check. So the nurse is teaching a client about coughing and deep breathing techniques to prevent postoperative complications. Which statement is most appropriate for the nurse to make to a client at this time as it relates to these techniques? So again, this would be a think, share, pair activity. After it appeared that students had shared their thoughts with each other, then I would ask the student to share, what answer do you believe is correct here?
1.
Perfect. Number 1 is correct. And so certainly when we think about coughing and deep breathing, preventing the postoperative complication, that hopefully should tie you into this being pneumonia. And so central spirometer is a great option. This is a classic example of NCLEX questions having multiple correct answers. So if you look at number 4, we do early ambulation and we do give administration of blood thinners to prevent pulmonary embolism. So some of you are going to say, well, I chose number 4 because that looks right to me. Number 4 is right. It's just not right for this question, right? So making sure that we always go back to the question and read what it's truly asking us can be helpful for answering these questions correctly. These are the resources that I used today, and I thank you for joining me today in my video.